last week we had the opportunity to be part of something that was really exciting. In our practice, we do a lot of breast reconstruction, and typically the way we do that is we place what's called a tissue expander the same day as the mastectomy. That tissue expander goes into the patient, and the traditional expander has a port built into it. The way we fill the expanders, we take a small needle and we put it through the skin into that port, and then we add either air or saline. The issue is that patients frequently come in and they're nervous about being expanded because they're concerned about that needle going through their skin. There's a potential risk for patients getting infected anytime you put a needle through the skin. And then every time we want to expand somebody as part of their reconstruction, there's the issue of they have to come back to our office. So most of our patients, from the time of their mastectomy, see us more or less once a week for the first 2 to 3 months until they get to that point where they're expanded to their final volume and are ready for the next phase of reconstruction. So last week we were the first practice in Southern California to place an AeroForm expander that's from the company AirExpanders. What this device is, same concept. It's a silicone shell that goes inside the patient's breast after the mastectomy, but inside that expander is a small canister of CO2. So rather than putting a needle in the patients, we're able to use a remote control device to activate a switch inside that expander that releases small bursts of CO2. So the patient goes home with remote control, and once they've healed appropriately, they use the remote control to very slowly expand that device. There's a lockout, so patients can only expand in a very slow, safe, controlled fashion that we influence. But what it saves them is multiple trips into CS. It saves them having to have a needle placed in their skin, and it decreases potentially the risk of getting an infection from those fills. So we're really excited to be able to have placed the first one in Southern California, and we're very excited to be able to offer this new form of expander to our patients.